smart enough to get yourself in here, to get the treatment without compounding the issue with who's going to pay for it.
When Rosemary Link's chemotherapy bill was rejected by Medicare, she spent hours on the phone trying to resolve it before she could start her next round of treatment. She receives her care at the Annapolis Clinic, but like many small community oncology clinics nationwide, it may soon have to shut its doors. Lynn Finnegan manages the clinic's nurses.
Every quarter, it sort of gets a little worse, and you think, okay, we can handle it. But January, it really became evident that practices like this can't survive.
84% of all cancer patients nationwide rely on outpatient community care clinics. Some clinics have closed or cut staff, while many more are struggling due to inadequate payments from Medicare and private insurance. In extreme cases, cancer patients are foregoing treatment. The public insurance option being worked on in several versions of Congress's health care proposals would be based on Medicare. But some say it's a broken system that needs fixing, not imitating.
You look well. I know you had some problems after the last one, but I think we'll get you through this, especially with the dose reduction.
Dr. Jay Rhee thinks the politicians have made health care reform too political.
So people come in not really wanting to understand about health care reform. They just want to find a way that the Democrats can pass it or the Republicans can block it.
President Obama often repeats the story of his mother who died of ovarian cancer.
I'll never forget watching my mother on her hospital bed dealing with cancer, trying to argue with health insurance companies, even though she'd been paying her premiums, saying that her cancer was a pre-existing condition, even though it hadn't been diagnosed when she first got her insurance.
But many cancer care specialists say the reimbursement situation is not being addressed.
It's a shame to have to equate medical care to dollars. It shouldn't be. There should be another way for this to be done.
This is a crisis now. It's a real crisis. It's not a made-up crisis, and we are endangering the world's best cancer care delivery system.